Hello guys. So as you all know that from Monday I have exams of my midterm. So first exam that is going to be on first May um is a physical diagnosis. So let's study together. Just a second, I'll just open this goddamn file. Where is my file? Okay, got it. So where is it? I could have searched for this topic. Anyway, it was very easy. Fine. Okay. We need to learn about the physical examination, about the tables that sir gave us. Where are they? I can't see it. Damn it. So health history. Fatigue and weakness, fever, chills, night sweats, weight change and pain. Fatigue and weakness. Fatigue is a non-specific symptom with many causes. It refers to a sense of weakness, of weariness, or loss of energy that patients describe in various ways. I don't feel like getting up in the morning. I don't have energy. I can hardly get through the day. By the time I get to work, I feel as I have done a day's work because fatigue is a normal response to hard work, sustained stress, or grief elicit the life circumstances in which it occurs. Fatigue related to such a situations require further investigation. Okay. So fatigue is a common symptom of depression and anxiety, but also consider infections like hepatitis, infectious mononucleosis, and tuberculosis, endocrine disorders, hypothyroidism, adrenal insufficiency, diabetes mellitus, heart failure, chronic disease of lung, kidneys or liver, electrolyte imbalance, moderate to severe anemia, malignancies, nutritional deficiency, and medications. Weakness, especially if localized in a neuroanatomical pattern, suggests possible neuropathy or myopathy. Okay. So, fever, chills, and night sweats. So, fever refers to an abnormal elevation in the body temperature. For definition of normal, ask about fever if the patient has an acute or chronic illness. Find out if the patient has measured his or her temperature. Has the patient felt feverish or unusually hot, noted excessive sweating, or felt chilly or and cold? Try to distinguish between feeling cold and shaking chill with shivering throughout the body and chattering of teeth. So, recurrent shaking chills suggest more extreme swings in temperature and systemic bacteria. Okay. Feeling hot and sweating also accompany menopause. Night sweats occur in tuberculosis and malignancy. In immunocompromised patients with sepsis, fever may be absent, low grade, or drop below normal hypothermia. Hmm. Weight change. So, weight change results from changes in the body tissues or body fluid. Good opening question include how often do you check your weight? How is it compared to an year ago? If there are changes, ask why do you think it has changed? What would you like to weigh? If weight gain or loss appears to be a problem, ask about the amount of change, its timing, and setting in which it occurs, and many associated symptoms. Rapid changes in weight over a few days suggest changes in body fluid, not tissue. Okay. Ooh. Weight gain occurs when calorie intake exceeds calorie expenditure over time and typically results in increased body fat. Weight gain can also reflect abnormal and accumulation of body fluids, particularly when the gain is very rapid. Edema from the extravascular fluid retention is visible in heart failure, nephrotic syndrome, liver failure, and venous stasis. Okay. Hmm. Okay. So, a patient with BMI of more than or equal to 25 or to 29 are defined as overweight. Those with BMI more than or equal to 30 are considered obese. For this patient plan, a thorough assessment to avoid the many associated risk of morbidity and mortality. Clarify the timings and evolution of weight gain. Was the patient overweight as a child? Are the parents overweight? Ask about weight at life milestones like birth, kindergarten, high school or college graduation, military discharge, pregnancy, menopause, and retirement. Has a recent disability or surgery affected weight? What about depression or anxiety? Is there a change in sleep pattern or daytime drowsiness suspicious for sleep apnea? Establish the level of physical activity and results of prior attempts to at weight loss. Assess eating patterns, and dietary preferences. 116. Hmm. So if the person's BMI is less than 18.5, the BMI is defined as a by the it is a ratio of weight in kilograms and height in meters and squared. Okay. So if the person's BMI is less than 18.5, then it is called as underweight. If the person's BMI is between the 18.5 to 24.9, then it is called as normal. Then overweight person is defined as a BMI ranging in between the 25 to 29.9 BMI. Okay, and obesity is defined as a 30 to 24.9, and yeah, obesity is again classified into three classes, one, two, and three. So, first class obesity is defined as 30 to 34.9. Second class is defined as a 35 to 39.9, and third class is defined as a more than 40. Gee. Okay. Many drugs are associated with the weight gain, like tricyclic antidepressants, insulin, and sulfonylurea, contraceptive glucocorticoids, and progest, progest, progestational steroids, mirtazapine, and paroxetine, gabapentin, and valproate, and propranolol. Causes of weight loss include GI diseases, endocrine disorders, diabetes mellitus, hyperthyroidism, adrenal insufficiency, chronic infections, and HIV/AIDS, malignancy, chronic cardiac, pulmonary, or renal failure, depression, and anorexia and or bulimia. We should write it down this way. Write this fucking thing down. Okay. Vital signs. Fatigue. Okay. Control C and control V. And does that. Recurrent changes suggest more restrictions in the machine. Okay. Okay. Drugs that are linked with the weight gain. Linked. Linked. Poverty, old age, social isolation, physical disability, emotional or mental impairment, lack of teeth, ill-fitting dentures, alcoholism, and drug abuse increase risk of malnutrition. Okay. So, drugs associated with weight loss include anticonvulsants, antidepressants, levodopa, deoxy, metformin, and thyroid medications. Okay. Okay. Page number 122 and 123. Where is it? 122 and 123. Okay. So, methods to calculate BMI, body mass index. Units of measure. Okay. Hey, yeah, this is very easy. The we take weight in kilograms and height in meter square, and we divide it. It's as simple as that. Why do you take the this uh, other measurements like lbs and inches? Why? If you know the weight in kilograms and height in meters, you can easily calculate the BMI. Why to take this inches and lbs? It's frustrating. Okay. So optimal pain. Pain is one of the most common presenting symptom in office practice. Each year, an estimated 100 million Americans experience chronic pain at a cost in medical care, disability, and work days lost or two of $560 to $635 million. What the fuck? Acute pain affects another 12% of Americans annually. The most frequent causes of are low back pain, headache or migraine, and knee and neck pain. Prevalence varies by race, ethnicity, and socioeconomic status. Localizing symptoms, the seven attributes of every symptom. Okay, so there are seven attributes of symptom. Oh, one, two, three, four, five, six. Huh? We'll search it. Chat GPT. Okay, here we go. So, what are seven attributes of Oh, okay. Intensity, location, quality, duration, timing, emotional response, impact on daily life. Okay. Okay. Health promotion and counseling evidence and recommendation. So the important topics for health promotion and counseling: optimal weight, nutrition, diet, blood pressure and dietary sodium, and exercise. Optimal weight, nutrition, diet. Fewer than half of the US adults maintain a healthy weight, defined as BMI between 18.5 to 24.9 kilograms per meter square. Obesity has increased in every segment of US population, regardless of the age, gender, ethnicity, geographic area, or socio-economic status. Review the alarming review the alarming statistics about the epidemic of obesity nationally and worldwide in the table on next page. See. So to promote optimal patient weight and nutrition, adopt the four-pronged approach outlined here. Reducing weight by even 5 to 10% can improve blood pressure, high lipid levels, and glucose tolerance, and reduce the risk of diabetes or hypertension. Okay. Okay. I get easy distracted, guys. Distracted. Fuck. So four major steps to promote overweight, optimal weight and nutrition. So measure BMI and waist circumference. Adults with a BMI of more than or equal to 25 kilogram per meter square. Men with a waist circumference more than 40 inches. Women with waist circumference greater than 35 inches are at increased risk for high heart disease and obesity related disease. Measuring the waist to hips ratio, waist circumference divided by the hip circumference may be better risk predictor for individuals older than 75 years age. Uh, okay. ठीक है. Hmm. Four steps to promote optimal weight and nutrition. Okay. So where is it? Hmm. Blood pressure and dietary sodium. So, you know what, guys? The sodium levels in the blood are very important to access the blood pressure. Whenever there is greater sodium in the blood, the uh, the blood pressure in the body increases. Why? Because the sodium attracts water. Okay, and blood pressure is due to the hydrostatic pressure, and this water contributes to the hydrostatic pressure. So that's why the blood pressure in the body increases. Okay. Exercise. Hmm. Is the patient acutely or chronically ill, frail or fit and robust? Is there clutching of the chest pallor, diaphoresis, labored breathing, wheezing or coughing? Is there wincing, diaphoresis, protectiveness of a painful area, grimacing or an unusual posture favoring one limb or the region of the body? Okay. Are there anxious facial expressions, fidgety movements, cold, moist palms, inexpressive or flat affect, poor eye contact, or psychomotor slowing? Okay. Parallel cyanosis, jaundice, rashes, bruises, or mottling of the extremities should be posed. Excess clothing may reflect the cold intolerance of half hypothyroidism, height, skin rash, or needle marks, anorexia, or signal personal lifestyle preferences. Holes or slippers, they just suggest a gout intolerance of gout, bunions, edema, or other painful foot conditions. Rundown shoes can contribute to foot and back pain. Calluses, falls, and infection. Copper bracelets suggest joint pain. Tattoos and piercing can be associated with alcohol and drug use. Grown out hair and nail polish suggest the length of the possible fillness between fingernails may reflect stress. Yeah. Okay. So these changes can have a serious but treatable causes like hypoglycemia, subdural hematoma, or post post postictal state. Patients often prefer sitting upright in left-sided heart failure and leaning forward with an arm rest. Oh, okay, so this is important. So patients often prefer sitting upright and in left. Okay. Look for tremors of other involuntary movements or paralysis. Tremors and involuntary movements. Abnormalities of gait and posture. Hmm. Hmm. So causes of weight loss include malignancy, diabetes mellitus, hyperthyroidism, then chronic infection, depression, diuresis, and successful dieting. Okay. Measurement of BP. So how do we measure the BP? Okay. Hmm. So definition of hypertension. Okay. So home automated blood pressure. What is the normal blood pressure? Let's read this blood pressure. So, complexities of measuring blood pressure. The accuracy of BP measurement varies according to how these measurements are taken. Of office screening with manual and automated clips remains common, but elevated readings increasingly require confirmation with home and ambulatory monitoring. In its 2014 draft recommendation, the US Preventive Measures Task Force reported that 5% to 65% of elevated office blood pressure failed to be confirmed by ambulatory monitoring and recommend ambulatory blood pressure monitoring to confirm the diagnosis of hypertension. Numerous studies show that the ambulatory and home blood pressure monitoring are more predictive of cardiovascular vascular disease and organ damage than manual and automated measurement in the office. Automated ambulatory blood pressure monitoring requires measures blood pressure at present intervals over 24 to 48 hours. Usually every okay. Gee. Hmm. So be familiar with the important features of different methods for measuring blood pressure summarized in the table below. Since errors in office readings raise substantial risk of misdiagnosis and unnecessary treatment. The ambulatory blood pressure monitoring gold standard. Wait, ambulatory blood. Yeah. So okay. Hmm. It is expensive. Auscultatory office blood pressure by with aneroid or mercury blood pressure cuff. Hmm. Hmm. Automated oscillometry because of hmm. Okay. 1 minute. Okay, so less expensive than the ambulatory acceptable alternative home blood pressure monitoring. Hmm. Normal is systolic is 120, less than 120, and diastolic is less than 80. Prehypertension 120 over 13 and T. Hmm. Uh, hmm. Heart rate. Hmm. Fuck. Okay. एक्सिलरी, रेक्टल एंड ओरल। सो सबसे ज्यादा होता है एक्सिलरी का, उसके बाद आता है रेक्टल, उसके बाद ओरल। ठीक। Okay, guys. So today we are done with the vital signs. So I will be back in 2 hours. Maybe I'll prepare something to eat for myself, and then I'll continue. So till then, bye.